And because I've met some people, I changed some procedures. And because I'm initially oral surgeon, this is better, this is nice here, sorry, to make, for example, le for one or a Anthogyr procedure than placing an implant in a flapless procedure, in a minimally invasive surgery. But we have, as clinicians, to keep always on mind that we are working for our patients' sakes. That means that if we have at least the same results with a minimally invasive procedure, at least the same, what is the best? Going for minimally invasive surgery. And in my small contribution, I will try to open one of these doors tonight. So, if we referring to, because the title was the placement of implant in atrophic region. And what is the definition of atrophy? Atrophy is a decrease in size of wasting away of a body part or tissue. That means that, of course, we know all the procedures of grafting, of gaining tissues. But all these, and this is the question, the main question, are these procedures predictables? Are there any other option where we have atrophic? There is. And of course, the first answer will go to this choice of MIS. MIS, minimally invasive surgery, is well known in different aspects, different specialty of medicine. And again, this is what give the dictionary as definition. Any surgical technique that is less traumatic to the body than traditional, with smaller incision than the traditional open procedure. But do you think that it's limited to this definition, MIS? Not really. MIS solution. MIS solution in oral surgery. MIS solution in implantology is not limited to an opening, flap. It's a full concept. It's a new vision. But you will see, not limited only on the procedure itself, but the way you're using these surgical tools, the way you're using these grafting materials, these biomaterials. And in implantology, what is the main problem? Of course, and I know that all of you are experts here. And placing an implant where you have very good conditions, plenty of bone and height and width, where you have good soft tissue condition, is not a problem. We all know that. At least 96%. The main problem is represented by lack of bone. It's not the only one, but this is the main problem. And this may be a solution, but we will need to optimize these bone volumes. Not thinking like the conventional procedure, subtractive, what I call is subtractive implantology. What is the conventional implantology? convention implantology, whatever you're doing, whatever kind of procedure you are following, whatever kind of implant you're placing, you're subtracted. That means that you're making your osteotomy to place an implant, to place a screw. Of course, and this is not new, we have a lot of minimally invasive options, like this flapless procedure. And I don't know if in this country, because I did this slide for a lecture in Japan, and Japanese people are crazy about golfing, you know. So I don't know if you're playing golf in this country. Anyway, but I've heard about golf courses in the middle of the desert, right? This is just like the hole-in-one. Oh, yes, sir. Yeah. So, the hole-in-one in golfing is the Graal. This is the dream of every golfer. He's doing the hole since the first shot. And if we can get the same outcomes in doing this, this is our Graal. But then we will have to manage this bone volume. And of course, the main important thing will be to preserve this bone. This is like gold. And this takes part of these MIS procedures. In conventional implantology, we have the solution, well known, well described in all these publications. Then, when we have a lack of bone, we have GBR or GTR procedures. We have the bone grafts, represented by bone block grafts, particulated, bone substitutes, beta TCP, or xenograft, allograft, etc. And we have bone destruction. But all these three are leading to invasivity, right? To morbidity of the tissues, are taking time, and are not predictable. Who can say here that a grafting procedure is predictable? How can you say here that the GBR, GTR technique is predictable? Nobody, because it's not. So maybe we have to shift again. And what about bone expansion, bone spreading, bone condensing? Of course, and this is why I did these different slides, and I did myself a lot of these conventional techniques to gain tissue. And this is what you can get with some grafting procedure. You can see all these gaining bone. But in lot of these publications, that is showing you that all these procedures are gaining bone. The question, or my question is, for how long time? And you probably, like me, have faced that in grafting these xenografts and doing a re-entry after years, opening a flap and taking a curette. What you get out of this? Wet sand, just wet sand. So, and without, with biomaterial, with no biomaterial. Not at all.